Throughout its 10 facilities across the country, American Hospice features interdisciplinary teams of experienced and caring staff members, all committed to managing symptoms and bringing the promise of comfort to their patients.
We have a situation and a place where people can come with a group of trained professionals, doctors, nurses, caring people that really want to help at the end of life. And what we do is we offer somebody to be able to come and spend the last days of their life with dignity, with class, with no pain, and with no suffering, and they just have the enjoyment of their family. This is what we offer at Embracing Hospice, is a way to die not only with class, but with dignity and without pain and suffering.
At Embracing Hospice, the principles that we were founded on was the promise of comfort to our patients, and that's important to us. So we're really trained on symptom management. We're approaching caring for dying patients in a new way. I think when people hear the word hospice, it's frightening to them, and really we come in and we offer them hope. We offer them a quality of life at the end of their life.
There are many human struggles and medical issues related to a life-threatening illness. The emotional and spiritual struggles of a patient with a short prognosis are often overwhelming. Once associated with only cancer patients, hospice now provides services that offer comfort and reduce the suffering of any patient battling a disease or condition that can no longer be treated.
I think there are a lot of misconceptions in the public about hospice care. Hospice is offered to any patient with heart disease, lung disease, dementia, anyone that has a life-limiting disease we can take care of. Another misconception is that we don't offer medical treatment, and we can do that. We offer aggressive treatment for symptom management so that they have quality of life.
As one of the largest hospice programs in the Atlanta metropolitan area, Embracing Hospice is committed to push the envelope and contribute to the art and science of hospice care in the state of Georgia by working with a patient's attending physician and family caregivers to develop a customized plan of care to address the needs of the patient and family.
In hospice care, we do what the patient needs. When you're dying, the needs are different, and that's what hospice does better than everyone else. What we try to do is coordinate a plan between attending physicians, between family members, between the patient and their needs and their desires. We try to integrate them all together and then allow the person to live their life to the best level that they can for as long as they can. We have a computer system that allows us to provide care continuously. That's a first. Secondly, we also have a ventilator release program which allows us to care for people that are dying on a ventilator and have their family around while we take care of them. Thirdly is we also have disease-specific care so that all our nurses and all our staff and physicians are specifically trained on specific diseases that have not been cared for in the past.
Hospice provides all the services related to the patient's terminal illness. That includes physicians, nurses, nurses' aides, social workers, volunteers, and anyone else that might be necessary to help provide a high quality of care. The Hospice Medicare benefit is a comprehensive plan which covers everything related to the patient's terminal illness, so there are no co-pays or deductibles. Many individual insurances have a hospice plan as well, and we can work with families and patients to help them understand the benefits of those plans.
Hospice also offers a choice for families who need support to address the human struggles and medical issues related to a life-threatening illness.
When my wife was diagnosed with terminal liver cancer, oncologists recommended we look into hospice. They not only took care of my wife, but they took care of my emotional needs at times. But the hospice group and the people, they are a unique group. I don't think anybody understands their love and affection and their dedication to the terminally ill.
One of the most recent successes here at Embracing Hospice is the opening of our newest inpatient unit. And what that offers to the community is the ability for us to care for their loved ones when they're not able to do that at their homes. But I think it's the day-to-day successes, the small ones that touch our families, that draw all of us here, our social workers, our CNAs, the nurses to hospice. We get those calls that because we were able to manage their symptoms, that the families were able to take their loved ones on one last vacation, or go out to lunch, or enjoy just some quality time visiting with them. And that's what's important to us here at Hospice.
What I really love about hospice is being able to help people have a peaceful death. It's offering hope to patients and families, to allow them to take time together to enjoy the last days of the patient's life. People often say, "Isn't it hard working in hospice?" And I say, yeah, it's hard, but it was harder working in hospitals when I would see patients hooked up to tubes and the family wasn't allowed to visit. And now we can have the patients and the families in home or in our hospice units being able to spend those last days and those last hours just being in touch with each other and allowing for that peaceful death.
I'm very excited for our future at Embracing Hospice. We have innovative techniques and methods to improve patient care at the end of life. So we have a computer system that is going to help us have integrated care and a continuous amount of care for that patient. Number two, we have inpatient units that are going to be strategically placed so that people can get to care quicker, faster, and more efficiently. Thirdly, education is a big component of our care. The hospice physicians, the nurses, all the administrators, everyone is going to be educated to the highest level so that we can provide the best amount of care for that patient.
We just put in a new music program. We're going to have an ALS program that's just going to focus on ALS patients. We have patient-focused, disease-focused programs that will allow us to give the best possible care to our patients, and it allows our staff to learn something new and to be really connected with our patients so that our patients and their families have the best opportunity. We're going to change the way that dying people are taken care of in Georgia.
We're here because we care, we love what we do, and we care about your health. We care about how people live, and we care about how people die. At the end of your life, you can still live your life and enjoy your life with dignity and without suffering. And that's what Embracing Hospice is about.
When time is short and medical science has no more to offer, hospice is a family affair that offers the promise of comfort. And Embracing Hospice is committed to changing the way dying people in Georgia are cared for forever.